Welcome to the Crooked Spine Show, another interview with Dr. Saeid Mustagh. He's my expert today. I want to understand how the brain and body work together to keep our mind and body healthy, and what that might be for both us, Dr. Saeid and myself, and our patients, and for our kids too. Really, everything in any age. For one, it can help people as seniors, young people at any age. So, Dr. Mustagh is my expert today. He's going to help us understand the testing and treatments to heal our body and brain naturally. He'll explain the signs of impaired brain function, sometimes caused from concussions, that include ADHD, headaches, fatigue, body pains, and more, and also the science behind natural treatments such as neurofeedback that can help us heal. So take it away, Dr. Saeid. How are you doing, my friend?
Thanks so much. I'm doing great. It's good to be on your show.
You're up in Vancouver, correct? You're up in Vancouver?
Oh, yeah, Vancouver. It's snowy Vancouver for change.
Yeah, it's amazing how temperature changes, again, obviously around the world, but just north of Southern California, how different it is. So hope you're doing okay over there.
Yeah, we're good. We did have a few centimeters of snow that actually stayed. Ooh. It's strange for this time of the year, but it's good for the mountains and the ski resorts.
Exactly. And you've been in Vancouver your whole life, or did you move there?
Oh, I moved here in 2016. Okay. Before that, I was in the Northwest Territories, Yellowknife, like way up north, northern Canada. And before that, I was in Toronto, and I immigrated when I was 17 from Iran.
Awesome. And again, I saw your background. You've got a law schooling for one too. Why did you choose to become a neuropathic doctor, naturopath?
So when it's a love story with water molecule to be going back all the way to it. I was doing a research project at the Sick Children's Hospital, working on a genetic defect. It's called the Fragile X syndrome, and it's an inheritance disease that the cognitive it leads into a cognitive decline, but it's a generational decline. So like each generation IQ drops down and down and down, and finally you get to a full mental impairment. And what happens is like the DNA polymerase that is replicating the gene is making mistakes, and it's just like not making enough repeats of the gene of the sequence. So there was some hypothesis around like maybe it's the water molecule interacting with the DNA that's causing that. And then I came across a dude that had come into Canada to study homeopathy. Homeopathy is all like water energetics, right? So I became familiar with that, and then I was looking to different programs, and I realized that if I became a naturopathic doctor, I could also learn homeopathy as part of it.
It's almost like you want to help people, maybe not from prescription medication, but more how do we deal with our natural environment that actually healed our bodies, Homo sapiens, for the last 10,000 plus years.
Oh yeah, absolutely. It's like the internal ability to find homeostasis.
That's chiropractic. We're in the same book for one too, which is good. Yeah. And why did you want to study brain health?
I had my own challenges growing up in terms of mood regulation. I'd had multiple concussions. I was quite moody going through school. I was smart, but emotional regulation was always a problem in my teenage years. And so the mental state, like the mind, was a really fascinating field. So I always had, even as a naturopathic doctor, you get this idea of like what's the mind-body connection, right? So that mind component was, for me, very interesting.
It's almost like you're looking at the whole person, not just what their symptom might be.
Oh, absolutely. And the whole person translates into like even the language of the person describing their problem.
Perfect. It's almost like you read a different way. And how would you, for someone that may not know, how's a naturopathic doctor different than a medical doctor or even a chiropractor?
So the difference, the education is pretty rigorous. It's the same. You do 4 years of undergrad and then 4 years of naturopathic medicine, same as chiropractic. So you get an undergraduate degree in sciences and then 4 years of naturopathic medicine. You learn the same things a medical doctor learns in terms of like the therapeutics, the diagnostic algorithms, the medications and whatnot. But then you learn the natural treatments that go along with it. So herbs, homeopathics, acupuncture, some physical manipulation, and a lot around diet and lifestyle and what are the basics of creating health.
You're
So
almost learning more in addition to just medicine, almost exactly how we can do things on a more of a natural sense.
yeah, you definitely like the load is definitely more than a medical doctor, with the exception that a medical doctor in their fourth year they move on to full on practice, whereas in our case it's like half time practice, half time still learning, because
Mhm.
the additional herbs and whatnot is just it adds to the stack of what needs to be learned, and the medical doctors definitely get more practicum in diagnostics and in pharmacotherapies, whereas ours is limited.
It's almost they get the residency, which actually is part of their training, getting paid for maybe a little bit here and there. We're
Yeah,
almost like, okay, we got to go out there and start working and then continue learning as you go.
absolutely. Like our residency is limited. Their residency is typically 2 years, right? Like fourth and fifth year. Our residency is only on the fourth year.
Perfect, perfect. And how will you differentiate between, say, a functional medicine approach versus a medical approach when talking about dealing with patients and that diagnostic type of field that we have to deal with?
Right. That's a very good question. It is a very subtle difference, right? Because when
Very.
someone comes in with a disease in front of you, the medical doctor's perspective is it starts from the pathology. So the question is, what
Good.
is the disease, and then what is the algorithm tell me in terms of the therapeutic order? Whereas in naturopathic medicine, it starts from the person and the physiology rather than the pathology, and the therapeutic order revolves around. So if you look at the therapeutic order in the medical field, it's medication, surgery, right? That's
Huge, yeah. Or,
the
or
two.
maybe send out for physical therapy, maybe some shots here and there, something else
Yes,
in between.
absolutely. Like some
Yeah,
physical therapy, me- medication, physical therapy, surgery.
yeah.
Whereas the therapeutic order in naturopathic medicine is lifestyle. So looking at
Mhm.
nutrition, sleep, movement, and connections, like your connection with self, your connection with others, your relationships, and whatnot. Then it goes into using herbs and supplements.
Good.
Then it goes into using medications and acupuncture and then minor surgery. And we end at minor surgery. We don't really have, like, we can't go into full-on surgery and whatnot.
Yeah, you're not doing open heart surgery at your office.
No, no. So we look at the function. They look at the pathology. They look at the disease. We say, well, how did the disease come about in the first place?
So, for example, what would be an example of someone coming into your office to differentiate those two approaches with, say, severe headaches, migraines, light sensitivity, those symptoms? How would you differentiate a treatment from your functional medicine and being a naturopath versus someone who's in the medical field?
Okay. So in the medical field, someone comes in with those symptoms. The question is, where does it fit in the DMSI diagnostic criteria, right?
Mm.
Is it a migraine? Is it a cluster headache? Is it secondary to a head injury? So on and so forth. So, like, the question starts with, what is it?
Mhm.
Whereas in my practice, it starts with, um, are you hydrating enough? Okay, are you sleeping enough? If there's been an injury, was it enough time to heal it?
Mhm.
If those are all in place, what is your stressor? What's the hypothalamic pituitary adrenal
Good.
regulation of that stress that is leading to this? Could there be food sensitivities associated with it? How long has this been a problem? Did it start at a time of a trauma or a stressful emotional event? Is there alignment issues? Is there movement impedance with that? So it looks at, again, how does the function and the physiology operate versus what is the pathology. So in a lot of terms, the pathology is not really important to me in practice. Whether I call the migraine or cluster headache, it doesn't make much of a difference.
Mm.
It makes a difference in terms of the prognosis, in terms of communicating to the patient how long to expect in terms of the healing and recovery time. But in terms of the treatment plan comes down to the basics of how do you create health.
Perfect. It's almost like you're looking at it, and yours would be more like a full detail of the person causing the symptom versus actually just treating the symptom. And then if it doesn't go away, we'll give you something else. Doesn't go away, we'll do that. If it doesn't go away, that might be in your head. We'll do some psychotherapy. It's almost like dealing with just that versus no, I had this event happen. I had this fall, had this trauma, had this sports injury. Now that's why my headaches won't go away.
Yeah. And that's a kind of like a lot of times a blind spot for medical doctors, because you can have a head injury or a sports injury, and a few months can pass and you still are symptomatic. And then you go in there and, the whole idea of diagnosing it as post-concussive syndrome doesn't make sense to them, because there's no algorithm for saying prescribe this or that or the other. Whereas if they diagnose it as migraine or cluster headache, then they can say use this prescription or that prescription and go down the algorithm.
You're almost, and again, same thing in the U.S. too, and in Canada, it's almost there's no in between. Either you do this or don't do this. If it's
their hands are tied. Their hands are absolutely tied. If they
unless it's so severe, it's so severe to where it's like, okay, they're having throwing up. They have this. We're going to an MRI. Then they get into a specialist. But if you're going like 3 months later, I feel okay, but now my headache's gone. But now I have license today. It's like and sometimes patients, as we know, they won't give you all the information. You have to kind of dig it out of them. Well, if you had this, do you have this? Oh yeah, I forgot I had that 5 years ago. That did happen. How did you know? I'm like, because I can read your mind. No, I just have the questions in my head. Again, as you know from experience, that you want to make sure you cover all your bases.
Absolutely. Yeah, that definitely is. And that the other thing about the naturopathic practice is we actually get time with our patients, right? Perfect. So initial visits are often an hour and a half. Versus the 15 minutes or 30 minutes that the medical doctor does. So the history can come out during that time period, and you can get a sense of what's going on in that time period.
It's almost like the patient, hey, look, this is not your typical walk in, spend 2 hours waiting to see your doctor, then see your doctor for 5 minutes. You'll spend 15 minutes here doing maybe some paperwork and then seeing me for an hour and a half.
Yeah.
The reverse for 1, 2. And let's walk through 2, Doc. What's typical first assessment for a new patient in your office? How does your office work?
So my practice nowadays is split 50-50 between head injuries and concussions, or like cognitive stuff, versus some of the clients that I get referred to for like gut issues, hormone issues, immune issues. So in terms of like the second, gut, immune and whatnot, it's a typical sit down, go through the history, look at the labs, maybe order some functional labs, and then go based on that. In terms of the brain assessment, it always starts with a QEEG, quantitative electroencephalogram. So we put these electrode caps. I got a few of them behind me. Standardized 10-20 caps. So it goes over the person's head, and we record the electrical activity of the brain at rest for 5 minutes with eyes open, 5 minutes with eyes closed. Typically, out of a 5-minute recording, you're able to get a 1 minute of clean data, because any type of muscle movement, eye movement, blinking, chewing, jaw tension, of itself creates electronics that the cap is picking up. And so we edit those out, and we get 1 minute of clean brain data. And then what I do is I upload that data to 3 different databases. Perfect. One is called a normative database. So individuals within a 2-year age gap of the person that don't show any or report or complaints cognitively. Another data that I compare that individual to is a concussion database. It's a database of 280 individuals that had their EEGs done after confirmed concussions. And then a third data, so that one looks for inflammation. And the third database is a database of individuals with anything cognitive or emotional. So you name it, like anything as low as anxiety, dyslexia, all the way to schizophrenia, depression, slow readers, this anything and
Sure.
everything in between that spectrum. ADHD, executive function. So once I get all of that, then I can see where this brain electronically is fitting. Is it showing signs of inflammation and concussion on the second database, concussive database? Is it way off in terms of being within the bell curve to the normative database? And if so, within which areas of the brain and what networks? And then from a clinical database, I can figure out which specific networks are impacted. Is it the language? Is it the visual? Is it the attention networks? If it's the attention networks, which one of the attention networks, and so on.
Nice. It's almost like you're able to narrow down from the brain nodes what's firing, what's not firing properly, where the problems might be. Then once you get that, and I'm gonna link in the show notes too, the video you had sent me, or maybe one of the links I had seen from all your links, about how that explained more in detail and actually the visual of the cap itself and how the training goes. How do you then, once you find out what the problems might be or inefficiencies, how do you then exercise or train the brain to fix that?
Okay. So if the person has inflammation,
Got it. Okay.
you got to remove the inflammation. That's the first thing. If there's inflammation, we use anything that is natural but anti-inflammatory. So sleep becomes a key thing. Making sure they got hormonal balance, enough testosterone is another one. Making sure they got good movement is another one for the inflammation and the flow of the lymphatic.
Okay.
And also mainly I use intravenous NAD for that.
What is that?
NAD plus is nicotinamide adenine dinucleotide. It's an active form of vitamin B3, niacinamide, that helps with mitochondrial respiration.
Perfect.
So post concussion, certain areas go into like areas of hypoxia. So there's differential utilization of oxygen within the brain. So NAD resolves that, and it slows down that mitochondrial stoppage.
Perfect.
So for inflammation, I do that. But then if the person doesn't have an inflammation and they're in a post-concussive state where networks that are supposed to be communicating with each other, they're not, then we give them neurofeedback as exercises to recreate the connectivity of the brain.
How does that work when you talk about retraining the brain? Is it they're doing a puzzle, they're doing certain exercises on the computer or at home? How does that work?
Yeah. There is, for patients that are in town and have access to our clinic, it's always in front of the computer. The same cap goes over their head. Let's say, 52 nodes on each side of the brain, the Brodmann areas, and we identify that like 5 of them are not, out of the 10 noded network, 5 of them are not working.
Okay.
So we map those areas and we write a program. They sit in front of the computer. The cap is over their head, recording their brain waves. And every time those nodes are not firing properly, they would be watching a video, and the video will shrink into a dot, so they can't see it. In a way, it's direct feedback to the person about what their brain just did. And when those nodes are actually firing, it actually goes, the video becomes full screen. So in the process of that, a brain that sees itself is a brain that heals itself. So it's like direct perception into the functioning of your brain. So if you can see that, the last 3 seconds, my brain wasn't doing good, and now it's doing good, a repetition of that will lead into those networks and connectivity coming back online.
So the brain can actually heal itself once it realizes there is a problem, and at that point reset, and then the positive reinforcement is now the screen's bigger, or something's happening where now it's more clear, whatever it might be. How long does that actually take to work, or is that just per person and their symptoms?
It definitely depends on the history and the person and the symptoms. But overall, one of the things I tell patients is, if you look at certain organs, each organ has its own cycle, right? So like if you look at liver, for example, every 3 weeks or so, you got a brand new liver, in the sense that certain cells died, certain cells replaced it. The brain, that cycle is a 7-year cycle.
Okay.
right? So roughly about a 4 to 6 months of training is what we aim for correcting the deficiencies of the brain. So that's actually really good time. If you think about, let's say, if someone that comes in that post concussion, they have lost their attention networks and they are exhibiting with ADHD type symptoms, the attention networks take a full 20 years to develop.
Ooh, okay.
Take like the first 18 years, it's your ventral and dorsal attention network, and then the last 4 years, 5 years of that, even until 25, is your emotional attention networks, right? That's why they don't give you a license until you're 21, or if you rent a car, they will charge you more for the insurance, because you could be driving and an emotional attention network can take over the other attention networks, and the next thing you know, you're not paying attention to that which is important right now, right? So
I'm gonna use that. I'm gonna help my kids use that excuse. Hey, your body's not developed, your brain's not developed yet. So tell the cop when he pulls you over, exactly. Hey, it's not me, it's my body.
Yeah, yeah. It's not me. It was my emotions.
I can't control it, man. Look at me.
Yeah, exactly. Yeah. So it's 4 to 6 months is actually a reasonable, quite reasonable time, and in fact, it's a fast pace, because one of the other things I do while they're neurofeedback training, if you have identified areas that are like not getting enough blood flow and not getting enough activity going on, we also like use pulses of red light therapy and pulses of electromagnetic waves directly over those areas. So now they're kind of like stacking neurofeedback with pulse EMF with red light therapy, which kind of like boom, it's a really fast recovery from any condition.
You're accelerating the healing process by increasing mitochondrial function, by decreasing the hypoxia and getting more oxygen to the tissue. Things can heal at a faster rate.
Oh, you got it. And increasing connectivity. So three things at the same time.
And if someone, for example, is in post-concussion, say, how does this help the elderly or someone who has, say, early signs of dementia, Alzheimer's, things like that?
Yeah. So there's quite a bit of research nowadays that's coming up, like with early signs of dementia, Alzheimer's. Retraining the brain is the key thing. You just like the cells are starting to die. You want to create new cells and connections faster than the death of the connections, right? So you know how they give them a lot of like physical exercises, ball tosses and balance and whatnot. These are all building new networks within the brain. The first 7 years of your life essentially is your brain is developing based on your physical awareness of where's my head relative to my body. So a lot of that type of exercises helps these individuals ahead of time.
And then so basically, so instead of the physical training, you're actually doing the brain training. So they all work together to help seniors get things to come back if they had a stroke before or some type of illness, that brain to actually start working more. That's fantastic.
Absolutely. It's the movement is a key thing in those patients, like getting them to do balanced movements of balance and ball tosses and like hand-eye coordination is absolute must. But then stacking that up with neurofeedback definitely enhances and improves it.
And then going into, for example, children or kids that are diagnosed with ADHD, how does neurofeedback or something like that help them improve?
Yeah. So with neurofeedback and ADHD is one of those things. Obviously, there's a lot of opinion on it, and there is a lot of diagnosis that comes about these days. That kids get the diagnosis, but fundamentally, when you look at attention networks, they're developmental networks. So if somebody has low attention at age 7, it's just they're a year or two behind in their attention networks. So medicating them, which is what the medical doctor would do right away, is really counterintuitive to
it's slowing down their development even more.
Oh yeah, it's going to slow down the development, right?
Okay.
So instead of saying, hey, here's a child that's developmentally delayed, or here's a child that needs a little bit more physical attention, or here's a child that's at home because of the stress environments, they need the movement in order to maintain the focus. They're like, here's the medication for you.
Or here they're overactive in class. We have to medicate them to get them to calm down like everybody else.
Yeah, exactly. Yeah. Right. So and possibly like they didn't have the experiences for their mirror neurons to start working. Like mirror neurons are the neurons that say, okay, well, the other person is in that condition and I feel their state. So like mirror neurons are what kick in when you're watching a sports game and you're having the excitement from like,
Sure.
things
Unless
going.
it's my team where they're a bunch of losers.
Yeah,
Can't get to
exactly.
the game. Yes.
Yeah. So like a child that never had a chance to sit in an environment with a bunch of adults in a circle, quiet for extended period of times, their mirror neurons never developed, right?
Nice.
So instead of creating those environments for those neurons to develop, they immediately move into the medication route. But what we do here is educate the patients and say, one, let's look at the nutritional components. If your child is having a food sensitivity to like dairy, sugars, some of the colorings in food, processed food and whatnot, well, let's keep those out. If there's brain inflammation, let's reduce the inflammation, because the brain that's inflamed is not developing properly.
Exactly.
And then the third thing would be to say, okay, can we enhance, facilitate, or accelerate the learning process on the attention networks? That's where we write the program specifically for the attention networks, and then have the child in front of the computer training that attention network.
You're almost helping I want to say even the parent understand how to help their children naturally to either eliminate things from their diet, lifestyle, or add them in along with neurofeedback. So now you're helping the parent, I want to say, to help their child directly versus medication, and helping their brain develop at I want to say fast rate, but a more natural rate, so they can improve themselves. I mean, it's like kids, right? Being kids, some kids are going to be in say 4th grade, 3 feet tall. Some are going to be 4 feet tall. They're different development ages, different physical ages. Why separate their development, mental, cognitive ability versus their physical ability?
Yeah, everything is a bell curve. Some of them are lower in the bell curve, some of them are higher. It's just respecting that and giving the time and space for them to develop naturally.
And Doc, question for me in my own head: are you helping other naturopath and people in your process who do neurofeedback get that word out more too? Are you more of a mentor for other naturopath or people in neurofeedback?
That is, we every year we have to do a self review of like what we are doing in our field and in the general public and whatnot. So this year when I did my review, I used to teach at the Boucher College of Naturopathic Medicine here, now Canadian College of Naturopathic Medicine. I used to teach there, and that was really rewarding, working directly with the students, and they used to come and preceptor with me. I still take some preceptors, but that's one area that for me, it's kind of like that I need to build up in terms of mentoring more of the students. It is the realm of neurofeedback is gaining momentum with a lot of the psychologists.
Good.
Because if you think about psychologists or psychiatrists, those are the only kind of like medical professionals that work with an organ, but they don't have the ability to look into it.
Medication.
But with psychologists nowadays, there is a lot of momentum around neurofeedback for sure. They're using that. The difference between I'm one of the few naturopathic doctors that does that, and it came about after I attended a integrative mental health IMMH Integrative Medicine for Mental Health conference, and I got introduced to neurofeedback, and it was kind of like shocking to me that I didn't know about it until now. So I went and got training, brought it into practice. But the difference between what I do and a psychologist does is I do the neurofeedback and the functional assessment and whatnot, but I also do the physiological assessment of the person, is in terms of like, is there genetic, like, do they have a deficiency on their methylation? Do they have a deficiency on their detox pathways? What is going on in their nutrition? So some of those aspects are that I pay attention to that are not paid attention to in a clinical setting at a psychologist is what is
you almost get a bigger bird's eye view of what's going on with the person, not just the patient itself for one too.
Yeah, you got it.
Which is great.
Yeah. What's going on with the person? What's going on with the family? What's going on with the generational trauma?
The social aspect around the person or in school, whatever it might be, also, which is great. Yeah. And another thing too, looking at wrapping up somewhat soon. Give us a testimonial of a patient that you helped that was a kind of surprise result for you.
Man, it's been so many patients, right? I would say there was one particular, like in terms of kids, it's always rewarding because they mostly come in because the parent is being confronted by the school system wanting the child to go on medication,
Okay.
and they come to me as last results typically, and that's
Okay.
really like, I wish people came to seek this, alternative medicine a little bit sooner than leaving it as a last result. That's really what it is. So those are always the most rewarding, and also the post concussive cases. Those are rewarding. Um, I mean, if on our website there is a bunch of testimonials of people that have come in with post concussion that have done this and that and the other, and they've been helped, but the cognitive aspect wasn't coming online, and how neurofeedback and the combination of things we do here has helped. ADHD for sure, attention disorder, adult attention is a little bit tougher.
Okay.
Again,
Okay.
because it's just certain pathways are built in, but those ones also get an improvement. Most of them are already medicated, but then with medication they get improvement in terms of their attention.
What I like is that you have the data, so you can compare the data from say day one to day, say their eighth, ninth, 10th exercise, and go, well, actually, hey, we're seeing improvement here. Boom, boom. It's very objective versus just
Absolutely.
me or you saying, hey, you're doing better.
Absolutely, because that's like the medical. You were talking about the difference between medical
Yeah.
doctor and was, so the medical doctor, even the psychiatrist, when you go for like an attention ADHD assessment, it's all subjective. It's kind of like, here's a form. Let me ask you a bunch of questions. What do you think? What do your parents
Mhm.
think? What do the people around you at school think? Whereas this is kind of like directly looking at the brain and saying, okay, well, this brain on its attention networks, on its, and in fact, it actually goes a little bit deeper than that. It says like, okay, if you think about your attention network as a sieve, the holes in there are more or less the ventral attention network, and then the solid parts are the dorsal attention network. So you can distinguish between, like, is it a data processing issue, or is it a taking the data, relaying it to the rest of the networks issue?
It's amazing when you can break it down that in depth. And that point, as we know, is then you can actually specifically treat that minute issue in detail versus the overall general type of treatment.
Yeah, yeah, fascinating.
Fantastic, fantastic. And Doc, as one more thing I want to ask, just off the show notes, is if someone is, for example, just a parent, and going, hey, I want my kid to do well in school, good in sports. Is it good to get an assessment when they're healthy in that state as they're growing?
Yeah, especially if they're in sports, like having a baseline is really important,
Huge.
because some of the changes, especially a child that's like in contact sports, what happens is, you get one concussion or head injury, and the rest of the network is compensating. You get another concussion, and another node is down, and a third node down. Is by the time 30% of the network is impacted, that's where the problem starts showing up,
Okay,
right?
got it.
So having a baseline always helps to know where the person is.
It's almost, and like you said, maybe the first question has no symptoms, but the second, third one then said, how did the person then just fall over? Now they can't even see anymore. It's like it didn't happen overnight. It happened first. And is this becoming more like I think I saw in one of your videos, more common with sports teams, maybe high school, college, the professional teams also?
Oh, absolutely. All the professional teams do neurofeedback nowadays.
Nice.
It's like the in Canada, it started with some of the Olympians in triathlons doing neurofeedback, especially for like the shooting part.
Okay. Okay.
It's just like putting yourself in the zone. But then the Spanish soccer teams picked it up, and now some of the hockey teams are actually, it's just part of their routine. The same way you go like train your body,
Wow.
you train your brain to be on the zone and not get affected by the external stimuli.
Did you watch the last Olympics in France where the Turkish shooter he came
I've
in?
seen clips of it. I've
Yeah, he
seen
came in
clips of
throughout
it.
the plane, had his normal clothes, normal
Oh yeah. Oh
sunglasses,
yeah.
boom,
Yeah.
went down,
The
boom, he
weird
popped
headlight.
it, gets
Yeah.
back on the plane, goes home. He'd
Yeah.
probably be, I don't know, probably some
Yeah.
special agent or
It's
something.
like
You know,
it's like
crazy.
another day in the woods for me, right?
Yeah, yeah, just got a little extra work, you know. Crazy, crazy,
Yeah.
crazy. Well, Doc, as we finish up, anything you wanted to bring up that you thought we kind of missed from the show?
Oh, thanks so much, man. This has been a great
Oh,
chat. It's always good to talk to like-minded people, and thanks so much for doing the work and educating people. And I know it's a lot of work doing this type of work, and editing it afterwards, putting it on the show, and trying to reach to people. So good on you. Thank you so much.
well, and I learned a lot from it too, and I shared with my patients, and then people have more and more shared my show. For me, it's not really work; it's fun. Get to meet more people. I looked at all your videos yesterday and learning about neurofeedback for myself. I mean, my wife says I like concussion, but that's more of a personal husband-wife type of rivalry thing or something. I don't know.
Yeah.
I don't know what it is. And getting into it too, what's a good takeaway from my audience to start looking at their brain more specifically with maybe they have headaches, something else too? What's a good way to kind of get them more open to that or self-check maybe they can do to see if they're ready for neurofeedback as a way to help them become a better mental attitude or personality?
Yeah, I would say if you have any type of cognitive or mood disorder
Okay.
or brain thing, always include concussion or post-concussion as one of the things to rule out. There is clear evidence in college aged students that if there is depression, it can show up like 6 years after a concussion.
Wow. Okay.
So that's always like if there has been a head injury, if there's been an impact to the head, you always include concussion as one of the rule outs or post concussion as one of the rule outs in the mix.
Fantastic. All right, Doc, quick thumbnail hold. I'm gonna have us both smile for 5 seconds for the thumbnail, and we'll call it a day. All right, my friend. Anything else you want to talk about?
Oh, thanks so much, man. All good. I think we covered a lot of bases on this, even though it was a short call. But yeah, we touched on a lot of things here.
Because people are interested in like, how do we make sure our brain, not just our body, is doing well? Where if you have a pain, is it really the one part of our body, or is it coming from somewhere else? So thank you, Doc, for being on the show. Holding out for 1 second. I'm gonna end the show. Thanks, guys, for watching, and I'll see you on this side.